If you were to be able to talk to somebody who's in the most early stages of their diagnosis, where they've just gone to a GI and they've had a scan that looks suspect at their local hospital, or maybe even a scan that's negative, but they're having symptoms, and they have reason to think that this might be pancreatic cancer. What would you recommend as sort of the marching orders in how do I find a physician that, or should I just go to my local oncologist? Should I try to track down somebody who's a specialist in this disease? You know, what about trials? Is it something that I should be thinking about before I start other treatments?
The number one piece of advice that I give to patients who have just been diagnosed with pancreatic cancer, or there is a suspicion of pancreatic cancer, is to take a deep breath. I'm afraid that many people who have heard this diagnosis reach not for the easy button, but for the panic button. And they will start picking up the phone or calling anybody who will see them as soon as possible, whether they're necessarily the best person to see them or not, and have a huge sigh of relief that somebody will do something as fast as possible. I will tell you that sometimes leads to bad outcomes. And I think the number one piece of advice I have for people is to take a deep breath. I encourage people to ask whomever the physician is who has seen them and has raised this either suspicion or confirmed they have pancreatic cancer, if it were you and you could choose to go anywhere in the country to be evaluated, where would you go? A lot of patients, particularly at a place like MD Anderson, believe they need to have the name of a single doctor to get into the system and be seen. They also have the sense that both from their doctors and their brainstem, that if I'm not seen tomorrow, I'm going to die the next day. They should not have that perspective. And if it takes a week to get to see an excellent specialist at another institution in a major medical center, I advocate many times comprehensive cancer centers as funded by the National Cancer Institute. You know, I think it's well worth the wait. The doctors at those centers recognize that patients are upset and distressed and want to be seen as soon as possible. But if you have to wait 5 days, a week, 10 days, that should not lead to a lot of distress. And the number one thing people need to do, take a deep breath, get some information, make some phone calls, and try to decide what's best for them. The other thing I think people need to do as part of that deep breath is, if I go to this city that's far from my home, I need to recognize that's not a one-time deal, and then I come back home and my problem is solved by outsourcing. That a decision to go seek an opinion elsewhere at some level may turn into a real commitment to continue to stay at that center for treatment. The transportation issues, the lodging issues, is there any sort of social network of friends? You know, my brother-in-law's sister lives in Baltimore or in New York or Boston or Houston or Chicago or LA. To allow people to really think this out a little bit, as opposed to get me on the first plane to Chicago and I'll figure it out from there. To recognize that, you know, this is going to be an uphill go, and it may require real commitment of my finances, my family, some friends, and an extended social network to deal with this. And to think about that early. And it's part of the deep breath, that to just let your brain go crazy is counterproductive for many patients. And it's easy for me to say that because I've never been diagnosed with pancreatic cancer. But in seeing patients who've just tried to find the first person who will take care of their problem, Many times that hasn't ended well.
What advice do you have in how to interview a doctor and make that selection when it's a life and death?
I think one of the, I guess there would be two primary things that I would be looking for. One is to get a sense that the physician is listening to you, as opposed to they ask you a question and then they're like, seem to be distracted or whatever. That they're actually registering what you're saying, not hearing you, but listening to you and your concerns. Two is to ask them, how easy is it for me to communicate with you? Will you do email with me? How do you communicate with other doctors about my case? What do you do in your own practice that will communicate with my endocrinologist or the surgeon or the radiation therapist? At MD Anderson, within our complex, it's fairly easy. We all share an information system. I tell my patients I like to email other physicians. I will get them on the phone if I can, but a lot of times, well, they're at the other office or he's out of town, et cetera. And so you can play phone tag until the cows come home, including them trying to call me. So I think, one of the things patients, it's very important is everybody on the same page and who is getting the communications. So a big part is, are they somebody who's going to listen to you? Is it somebody who's willing to communicate with you and your other doctors and try to figure out what's their style of doing that? And then this idea of openness of working with others, as opposed to, I'll do pretty much what I please, and, your other doctors can do whatever they please, and we'll all know about it, but it's up to them to decide what's best for you. It's a different kind of doctor. So, those are the things I don't sort of ask, well, where did you go to medical school, or what was your residency training, or how many patients do you take care of with this? It's more, are they engaged, are they listening, and what's their communication style going to be like? I am a advocate for centers of excellence in terms of taking care of pancreatic cancer patients, to regionalize the care to a certain degree, at least for those patients who really want to seek state-of-the-art care. I think that's true for surgery, for radiation, for endoscopy, and for medical oncology. I think it's a team approach. We really try to get everybody on the same page in terms of what are our goals of care, what's the best we can do for this patient, with the weaponry at our disposal. No one doctor has all the answers, and so at MD Anderson and many of these centers of excellence, it really is a team perspective in terms of how do we configure treatment that will optimize this patient's chances. And sometimes it's other ancillary services, the pain management team, our nutrition people. Everybody is asked to weigh in and help. And that's an environment that I describe as fully engaged with the patient's care at a holistic level, as opposed to what's the best thing for that cancer sitting in that person. If you lose the perspective of the patient, you sort of sometimes lose track of what's best. So we try to do that here. There are many centers around the country that are trying to do that. I think we just need to amplify those efforts.